you wondering about the difference between an ACL, an MCL, and what about the PCL and the LCL? Or if you just wondered why there's so many different knee ligaments and why they have different names and what they all do and why they're all so important? Well, we are here to answer your knee ligament questions today. Now, if you haven't had a knee ligament injury yourself, you may not have heard these terms, but if you're a football fan, often you will, particularly the ACL and the MCL. Those are the ones that are most commonly injured during football or even other sports, including soccer and things like that. So, the ACL and the MCL do not actually work together per se. The ACL is the anterior cruciate ligament, and it actually works with the PCL, which shockingly is called the posterior cruciate ligament. So the ACL and the PCL are actually inside your knee joint. So they are like underneath the kneecap, in between the big leg bone, which is the femur, and the big shin bone, which is the tibia. So what they do is they help to control the movement of the tibia, the shin bone, on the big leg bone or the femur. So it doesn't go too far forward or backwards. It stays in line where it's supposed to when you're moving your leg. So when you're walking, when you're running, when you're just lifting your leg up, whatever you're doing with your leg, the ACL and the PCL are the ones that help keep the tibia, the shin bone, in line with the femur. So really important ligaments, in all honesty. Can you live without them? Well, actually, we're starting to find out that you can. Maybe. So what we have found out through the research and just through clinical experience is that it is actually potential for you to have a pretty high tolerance to activity without your ACL. Now, the ACL is the one that's most commonly injured. So this is the one that's the most commonly studied. The PCL, we don't have as much research on, so I don't feel as comfortable saying that, but the ACL, they've actually found that you don't actually have to have it replaced if it's torn, if, there's a big if here, if you don't want to get back to any activities that involve rotation. So if you play soccer or basketball, or you want to get back to skiing, or you're probably going to be needing to have surgery because the ACL is part of that component that helps to keep that tibia, that shin bone, in place with the femur. But if your desired activity to return to is more something where everything's kind of in that straight plane, so you're running or you're walking or you do the elliptical or something like that, and you're okay giving up those other activities because you really could care less of whether or not you ever play golf again, then you could actually potentially live without your ACL. Because the ACL becomes really important when you're trying to perform any of those rotational exercises, so or activities. So ACL commonly is recommended for surgery if it's torn, but really surgery, the decision to have surgery should be based on what your desired activity level is in returning to your previous activity level, and what activities it is that you want to do. Because if you don't want to do things that involve a lot of rotation, you may actually not really need your ACL in the future. Now, if you have a complete ACL tear, will it ever heal on its own? No. Because once the ligament is torn, the edges come away from each other. They're not able to connect back up if it's a complete tear. And I have never met anybody who tore their ACL partially. Usually it's kind of an all or nothing thing. Either you torn it or you didn't. You just strained it. So usually if there's a tear, it is a complete tear. And if there's a complete tear, usually it will not heal. The ends just can't line up and find each other again. So if you want to have it corrected, then it would be a surgical case. But if you're okay with just running, walking, and doing those straight plane exercises for the rest of your life, then you could be okay to just do physical therapy, make sure you have enough strength in the muscles around that so it doesn't cause any problems long term, and off you go. So that's the ACL and the PCL. Now the MCL and the LCL, the MCL is the medial collateral ligament. And you'll be shocked to hear that the LCL is the lateral collateral ligament. Now these are on, the MCL is on the inside of the knee, the LCL is on the outside of the knee. And these are really important to maintain the medial and lateral stability of the knee. So more of that kind of side to side type of motion. So this is an accessory motion. That side to side type of motion is more of an accessory motion that we kind of use with everything. So you're going to use it with running, right? Because you need to have that stability. But then again, you're also going to use it with soccer because you need to have that stability. So MCL and LCL, you pretty much use all the time. Now the ACL and the MCL are often talked about together, especially when there's been an injury, because if you have an injury that's bad enough to tear your ACL, it will often end up tearing or potentially straining your MCL as well. So although they don't directly work together, because the MCL works with the LCL primarily, they are very close in location, and when there is an injury, they do have more of a tendency to be injured together. Now, MCL, the medial collateral ligament, is one that can tend to get strained a lot, especially when we don't have the proper hip strength to keep that strain off of the medial knee or the inside of the knee. So we do, in this case, see a lot of MCL strains that come from that poor hip strategy when we're doing activities. Now, again, with an MCL or LCL, if there is a complete tear and the edges are not able to find each other, they will not be able to heal back together. To get them to go back together, it would have to be surgery. Now, what are your outcomes if you choose not to do surgery? There's actually not as much research on this as there is on the ACL, but there are a lot more muscles that can compensate for the MCL and the LCL. Excuse me. So the MCL and LCL are outside of the knee joint, so it's a little bit easier to get those muscles to contract and help support that area and kind of mimic, if you will, that MCL or the LCL. You don't get that with the ACL and the PCL. They're inside the capsule, and the muscles, they don't attach inside the capsule. They're outside the capsule. So they can't really help as much. But the MCL and LCL, they can. And it actually has a potential to be able to stabilize that knee. But again, it depends on your level of activity. I mean, if it's your goal to go to the Olympics for the half pike, well, by golly, you should have surgery because you're going to need to have that stability in your knee. But if you're like, my desired level of activity is to be able to walk for a mile every day, you could be okay without your MCL if you're going to be in more stable conditions and not on uneven surfaces for long periods of time, not trying to do really high level of activities, things like that. So that's the MCL and LCL, really important for that side-to-side stability of the knee. But they do have muscles that can compensate for them. So sometimes we can pull those in. Again, it all depends on your desired of activity to get back to. And everybody's different in what they want to get back to and what their accepted quality of life is. If I told one patient that they could never ski again, they may feel like their life has ended. Whereas if I tell another patient that they can't ever ride a bike again, they're like, I never want to ride a bike again, so that's absolutely fine. Everybody has a different goal and a different level of activity that they want to get back to. So that's why we do those free discovery visits, because we want to have you come in, we want to understand what your goal is or what it is that you're trying to return to, and if we believe that we can help you get there. We don't want you to come in and spend time and money with us if you have an ACL tear and your desire is to go to the Olympics for skiing. you need to have surgery at that point. There's not something that PT can help after surgery, but if your goals are to reach that really high level of achievement, you need to have your body working at a peak level. Whereas if you're okay giving up skiing for the rest of your life, maybe you never liked skiing in the first place, maybe you've never actually been skiing in the first place, then that could be a different conversation that we can have. So this is what we do during our discovery visit, is to sit down, understand where your body's been, what's going on with your body, but then also what your goals are, because we want to know if we are the best people to help you reach that goal, or if there's somebody else that maybe you need to see first or instead of seeing us. The free discovery visit is a 20-minute visit. You come in and meet with one of our PTs, and we have some questions that we ask you so that we understand your story, what you've been through, and again, primarily what your goals are. If you choose to work with us, we'll use those goals moving forward. Those will become your goals for your PT treatment, because again, if it's not important to you, it's really not important to us. So those goals transition over to your PT program. We'll review them again and make sure we refine them in case you want to make any changes from the last time we talked. But we like to make sure we have your goals in the treatment plan, because if it's your desire to get back to skiing next winter, and that's really important, we want to make sure that that happens for you. Whereas if it's your goal to never go skiing again in your life, then we can make sure that doesn't happen for you too. All right. If you have questions about our free discovery visit, feel free to give us a call. Our phone number is 425-658-4944. And I hope to hear from you and get to talk to you more about your knee ligament story. All right. If you have any questions, you can drop them down here or feel free to give us a call. Talk to you guys soon. Have a good one.